show you that later. Packaging is not sterile. However, the vial itself is sterile, but the chemical is not. So you want to make sure you're not putting this in the insertion site, but you're applying it around the dressing and at the borders of the dressing. So I like to crack it and then invert, let that applicator tip fill with Mastisol. So I'm going to map out the dressing. We're gonna do it like this. And so about here. So we do want to, even though the secure cap is on, we do want to cover the wings. So right about here is probably where we'll go. So at the wing, and you don't need to cake it on, you just need like about a layer of it. So we got one line for the Mastisol, and we are going to tape it down all the way. Cover the wings, and now the patient is able to, there we go. There you go. And while I'm lifting up the edges, you do want to be careful and hold the edges down while you're removing, because it will lift the dressing and it might disrupt the dressing a little bit. And you guys notice I'm not applying the stat lock or sutures or anything else. I don't need any of that. In fact, if you apply stat lock or anything else, it's just going to get in the way. It's not extra securement. If the patient is strong enough to pull the secure cath or catheter out of the secure cath, that stat lock isn't going to do anything for the patient except get in the way of the care maintenance. So you don't need to apply anything else if this is applied. Save your money, save your time.